Hi, welcome to my channel Dentistry with Kashan. Let's talk about the management of epileptic patient on the dental chair. Before treatment, what things you could do to these patients? Like you have to take the complete medical history of the patient. You have to ask about the frequency of the seizures, triggering factors like stress. You have a dental light or any syringe or any fear or anxiety or past stress or any anxiety to these patients. Medications related to any medical history. Last seizure episode, when did it happen and how did it happen? You have to ask everything from these patients. Reduce stress and anxiety. You have to talk to this patient very calmly, very politely, in a very calm tone. Keep appointments short in the morning. Preferred appointments are perfect for these patients. You have to ensure the patient have taken any anti-epileptic medicine before the appointment on time or not. You have to reassure this thing very clearly before setting any appointment for any epileptic attack, because we cannot cure the disease. Like we cannot treat this condition of epilepsy, but we could prevent it by such medications. During treatment, what things you could do to prevent any further harm to these patients? Like you could not stop it, but yeah, you can do such preventive things to do not harm these patients. Like stop the dental treatment immediately. Of course, this step is mandatory in every emergency. Remove all the instrument from the mouth, like you were using any handpiece or you were using any mouth mirror or anything, or blade or suturing kit. Lower the dental chair safely. Turn the patient to the side position if possible. Then you have to protect the patient from the injury. Do not force mouth to open. Like if you have left any cotton or anything inside the mouth and the patient is continuously doing his teeth, like grinding his teeth and nails and things, you know, the epileptic attack, you all are very well aware, you know how does it look. You do not have to try to open the mouth of that patient because it won't. Do not restrain the movements of such patients. You have to turn the patient to the side position if possible, but do not try to restrain the movement of these patients. You have to leave them as such as possible. Maintain the airway and monitor the breathing, because if anything is left inside the mouth, you have to keep an eye on the breathing of such patients, because these patients have risk of accidental swallowing of any dental thing you have left inside his mouth. But even sometimes his own teeth could be swollen. If seizure lasts within 5 minutes, then this condition is called as status epilepticus, and you all know this condition. This is a medical emergency. You have to call the emergency medical help for the help. You have to give oxygen, like oxygenate the patient. Administer emergency drugs. There are available, like, you know, midazolam or diazepam. You can give it as IV or IM. After seizure has done, like the attack has done, the patient will feel confused, like what has actually happened to him. Like he will feel confused. First of all, you have to let the patient rest. Then you have to reassure the patient, check for any injuries by you or by him, any accidental injuries, and intervene them. Then continue the treatment only if the patient is fully recovered. Like this last step is not mandatory. You could not continue the procedure on the same day. You could do it and then the next day, like the patient is very calm and taken his anti-epileptic drugs, or you have referred him to his specialist, his neurophysician or whatever, and he is now well oriented that you could treat him. Then you have to continue your treatment. Otherwise, you could not do that. Okay, let the patient calm, rest, relax, and ready for the procedure. Do not force him. Give him another appointment and tell him to wait until he is fully recovered and taken his medicines on time. Any questions regarding this emergency, you can ask in any comments. I will explain. Thank you so much for watching. Try to subscribe my channel or share my videos so other people could be educated by me. So until then, take care. I will cover all the emergency one by one. If you want me to improve anything in my videos, I will do. But my goal is to keep it very simple and to the point, so it could be answered in paper, very line to line, in very basic answer. No need for any types of seizures to write there and what is epilepsy and the headings. No, you have to write the clinical things and the management. And yes, to the point answer. It's a gold standard in your final year. Like everything is so clinical. Like you will enjoy it if you like clinical things. Then final year is for you. Then best of luck and see you next time.